Millions of people struggle with stomach problems every day. It may begin with a burning feeling in the chest, a heavy stomach after meals, or constant bloating that refuses to go away. Some people feel nausea even when they have eaten only a small amount of food. These symptoms may seem small at first, but over time, they can affect comfort, sleep, and daily life. To help manage these problems, doctors sometimes prescribe a medicine called levosulpiride. For many patients, this drug helps the stomach move food more smoothly and reduces digestive discomfort. But there is something surprising about this medicine. It does more than simply treat indigestion. It can influence stomach movement, brain chemicals, and even certain hormones in the body. Because of these effects, it may provide benefits for some people, but also cause unexpected side effects in others. So the important question is this: what exactly does levosulpiride do inside the body, and is it always safe to use? In this video, we will explore the 7 big effects of levosulpiride, including its uses, benefits, and hidden risks that many people do not fully understand. Levosulpiride is a medicine that works by influencing certain chemical signals inside the body, particularly those related to dopamine. Dopamine is a chemical messenger that helps control many functions, including mood, nerve signals, and even digestion. When dopamine activity changes, it can affect how organs communicate and function. Levosulpiride belongs to a group of medicines known as prokinetic agents, when these drugs are designed to improve the movement of the stomach and digestive tract. Normally, the stomach pushes food forward into the intestines through rhythmic muscle contractions. However, in some people, this movement becomes slow or weak, leading to symptoms like bloating, nausea, early fullness, and discomfort after eating. By adjusting dopamine activity, levosulpiride helps stimulate stomach muscles and improves the natural movement of food through the digestive system. Because of this effect, doctors often prescribe it for patients who suffer from digestive conditions such as functional dyspepsia or gastroesophageal reflux disease. Understanding how this medicine works is important because it explains both its helpful benefits and its possible side effects. Effect number 1: improves stomach movement. One of the most important effects of levosulpiride is its ability to improve stomach movement. Under normal conditions, the stomach works like a slow but steady machine. After you eat, it gently pushes food forward into the small intestine so digestion can continue. But for many people, this natural movement becomes slow or weak. When that happens, food stays in the stomach longer than it should. The result can be uncomfortable symptoms such as bloating, nausea, heaviness after meals, and a feeling of fullness even after eating very little. This is where levosulpiride can make a difference. The medicine helps stimulate stomach muscles and improves the coordination of digestive movement. In simple terms, it helps the stomach do its job more efficiently. By improving this movement, then food travels through the digestive system more smoothly. Because of this effect, doctors sometimes prescribe levosulpiride for patients who struggle with slow digestion and persistent gastric discomfort. Effect number 2: helps reduce acid reflux. Another important effect of levosulpiride is its role in reducing acid reflux. Acid reflux happens when stomach acid moves upward into the esophagus instead of staying in the stomach. This backward flow can create a burning sensation in the chest that many people recognize as heartburn. In medical terms, this condition is known as gastroesophageal reflux disease. One reason reflux occurs is increased pressure inside the stomach, especially when the stomach empties slowly. When food and acid remain in the stomach for too long, the chance of acid moving upward becomes greater. So by helping the stomach empty more efficiently, levosulpiride can reduce this pressure. Less pressure means there is less chance for acid to travel back into the esophagus. As a result, some patients experience fewer reflux episodes and less burning discomfort. While it is not the only treatment for reflux, levosulpiride can be helpful in certain cases where slow stomach movement plays a role. Effect number 3, helps with functional dyspepsia. Many people experience chronic stomach discomfort, even though medical tests show no clear disease. This condition is known as functional dyspepsia, and it affects millions of people worldwide. Patients with this disorder often describe a heavy feeling in the upper stomach, early fullness during meals, nausea, or mild pain after eating. What makes the condition frustrating is that scans and laboratory tests often appear normal, leaving patients confused about the cause of their symptoms. In many cases, the problem may involve increased stomach sensitivity or slow digestive movement. Because levosulpiride improves stomach motility, it may help reduce these uncomfortable sensations. By helping food move more smoothly through the stomach, the medicine may decrease the feeling of fullness and improve overall digestion. Some patients report less bloating, reduced nausea, and better comfort after meals. While it may not cure the condition completely, levosulpiride can provide relief for certain individuals struggling with persistent indigestion. Effect number 4, influences brain dopamine. Although levosulpiride is often prescribed for digestive problems, its effects are not limited to the stomach. The medicine also interacts with dopamine receptors in the brain. Dopamine is an important chemical messenger that helps regulate many functions in the body, including mood, motivation, and nerve communication. Because levosulpiride influences dopamine activity, it can affect both the digestive system and the nervous system. This connection between the brain and the gut is stronger than many people realize. In fact, scientists often refer to the digestive system as the body's second brain because of its close relationship with nerve signals and chemical messengers. By modifying dopamine activity, levosulpiride may indirectly influence how the stomach functions and how signals are processed in the nervous system. However, this brain-related effect is also the reason why some side effects can occur. When dopamine signaling changes, it can sometimes influence mood, movement, or neurological balance in sensitive individuals. Effect number 5, may increase prolactin levels. One of the lesser-known effects of levosulpiride involves changes in hormone levels. Specifically, the medicine can increase the level of a hormone called prolactin. Prolactin is normally responsible for supporting milk production after childbirth, but it also plays a role in several hormonal processes within the body. Because levosulpiride blocks certain dopamine signals, it can lead to an increase in prolactin production. When prolactin levels rise too high, it may cause unexpected hormonal changes. Some people may notice breast tenderness, mild swelling, or changes in the menstrual cycle. In rare cases, prolonged elevation of prolactin may also affect fertility or hormonal balance. It is important to note that these effects do not happen to everyone. Many patients use the medication without experiencing hormonal symptoms. However, doctors usually monitor patients carefully when prescribing medicines that influence dopamine and hormone regulation to ensure that the treatment remains safe and balanced. Effect number 6, possible neurological side effects. Because levosulpiride interacts with dopamine pathways in the brain, it can occasionally affect the nervous system. Dopamine plays a major role in controlling movement and coordination. When medications alter this chemical system, some neurological side effects may appear, especially if the dose is high or used for a long time. Some individuals may experience mild symptoms such as restlessness, drowsiness, or fatigue. In other cases, muscle stiffness or unusual body movements may occur. These symptoms are generally uncommon, but they highlight the importance of using the medicine under medical supervision. doctors typically prescribe levosulpiride carefully and monitor patients for any unusual neurological signs. If side effects appear, adjusting the dose or stopping the medicine often resolves the problem. Understanding this possible effect helps patients remain aware of changes in their body and ensures that treatment continues safely. Effect number 7, can interact with other medications. Another important point to understand is that levosulpiride may interact with other medications. Many drugs affect brain chemicals, digestion, or nerve signals, and combining them without guidance can increase the risk of unwanted side effects. Medicines that influence dopamine activity, certain psychiatric drugs, or medications that affect the nervous system may interact with levosulpiride. When multiple drugs influence the same pathways, the effects can become stronger or unpredictable. This is why healthcare professionals usually review a patient's full medication list before prescribing new treatments. Even over-the-counter drugs or supplements may sometimes affect how prescription medicines work. For this reason, patients should always inform their doctor about any medicines they are taking. Proper medical supervision ensures that treatments work together safely rather than creating unexpected complications. While levosulpiride can help many people with digestive discomfort, it is not suitable for everyone. Certain individuals may need extra caution before using this medicine. For example, people who have neurological disorders should be careful because the drug affects dopamine signals in the brain, which are closely related to nerve function and movement. Patients who already have hormone-related conditions may also need medical guidance, since levosulpiride can influence prolactin levels in the body. In addition, individuals who are taking multiple medications should be cautious because drug interactions may increase the risk of side effects. Pregnant or breastfeeding individuals should also avoid using this medicine without professional advice. Every person's health condition is different, and what works well for one patient may not be appropriate for another. That is why a qualified healthcare professional should always decide whether this medicine is safe and suitable for a specific patient. In the end, levosulpiride is a medicine that can provide real relief for many people struggling with digestive problems. By improving stomach movement, it may help reduce symptoms like bloating, reflux, and indigestion. For some patients, this can make daily life much more comfortable. However, like all medications, it also carries possible side effects and risks that should not be ignored. Understanding how a medicine works inside the body allows people to make smarter and safer decisions about their health. Sometimes the key to better digestion is not just treating the symptoms, but also understanding the treatment itself. If you found this information helpful, and consider subscribing for more clear and simple explanations about medicines and health. Staying informed can help you protect your body and make better choices for your well-being.